I want to tell you about Sonia. Sonia is a really quite amazing lady who came to us some time ago. She suffers from a range of intellectual disabilities that have never really been diagnosed, and no one really quite knows what to do with Sonia, especially her carer. So her carer used to bring her along to this community store we established in Everton and drop her off at 9 o'clock in the morning and come back sometime after lunch. So we had Sonia for the day. Sonia wasn't sure what she wanted to do. She just wanted to eat the chocolates, so she did that for a while. We didn't help her nutrition in any sense of that. We ended up deciding that, or Sonia ended up deciding that she liked to price goods. So we had one of those little sticker guns that you price cans with, and if you have ever used one of those, anyone who grew up in a little corner shop, they sort of go click, click, thuck, click, click, thuck. You know that noise? So Sonia used to sit at the back and we'd all sort of get on with the day's work with this click, click, thuck happening in the background. But one day we noticed that the sound had changed and it was click, click, zzz, thuck, click, click, zzz, thuck. And it took us a while to twig that when you change the price on those things, there's a little wheel where you change the numbers and it goes zzz, zzz, as you do that. So Sonia was getting a pallet or a little case of baked beans, and she was pricing each one click, click, zzz, thuck, click, click. So you could have got anything from the greatest bargain in the world to something that looked like it had a telephone number written on it. Of course, when you got to Deb at the front counter who had Asperger's, Deb couldn't see any problem with the fact that the numbers weren't the same and would charge you whatever the can said. If you tried to argue, well, that's your problem, you could take that up with Sonia, who was out the back. Click, click, zzz, duck. The issue of food security exists within a broader context for us. On the ground level, if you deal with programs on the ground level, you know that food security in Australia is an emerging and growing issue. And yet it happens within what Tony Vincent has come to call a web of disadvantage. A web of disadvantage that is spreading beyond those who live in various parts of Western Sydney and other parts of capital cities in Australia, to include now people who once thought that they would live a life of relative ease and security, but who now find themselves queuing with those same down and outers that they used to be able to ignore and access services that they never used to know existed. We're one of those services. And I want to tell you about it, but before I do, I want to tell you a bit about the context in which we do that, because then it will make sense what I'm talking about. I won't take long on this, I promise, because my brief was to tell you about what we do as one solution on the ground. But you never let me stand up and give me a firm brief, because I will never follow it. I should have been a politician. Tony Vincent, as I mentioned, does most of our research for us. It's fascinating working with people like Tony, because they just keep thinking. And as you hear people like Tony talk, you get more and more of an insight into not just disadvantage in Australia or education in Australia or the criminal justice system in Australia, but Australia as a whole. So Tony has done a number of reports along the way, including Dropping Off the Edge. He did one a few years after that called Moving from the Edge, which had a bunch of really good news stories that tapped into some of those programs. Just earlier this year, with Claire Palermo from Monash, they did a report on access to adequate nutrition, the costs of a standardised basket of food in socially disadvantaged and comparatively advantaged localities in Victoria. And I'm going to refer to that a bit, so please forgive me, coming from a Victorian-based organisation, if I use Victorian stats, because they're just up to date. But what that report and what Tony has done with it has been quite interesting. It puts food security into the context of that broad web of disadvantage that takes into account housing and the fact that not only are housing prices going up and mortgage stress going up, but rental is going up. And for those in public housing, where rental stock is diminishing and becoming harder and harder to access, rental premiums, even in public housing settings, are increasing. So, for example, in the last 10 years, the average rent has gone up 83%, now taking about 50% of the average household income of those on benefits. You can see where this is going in terms of food security when half the money has just disappeared. Transport. I chose that picture deliberately because I'm talking about transport not only to food, but transport of food, not that anyone's going to eat the hay on the back of that truck, but I thought it was a great photo. Food going up, registration in Western Sydney is not always a high cost. But that is probably why you should never allow your car to get hit by someone driving theirs in Western Sydney. It probably isn't registered, or sorry, it may not be registered, it may not be insured, but it will be on the road. Fuel's going up, rego's going up, fares are going up, and that impacts people's ability not only to access support and food, but also then to participate in society in the normal ways that we take for granted. Debt and fines. Why is it that people on low incomes seem to attract fines at a disproportionate rate? Have you noticed that? If you haven't, it seems to be our experience. But because they actually get a fine doesn't mean that they pay the fine, which then means that they accumulate penalties on the fines, court costs, and the whole thing just escalates out of all proportion. These people who only started with half of their income a little while ago are now losing more and more and more to government fees and charges. The word is wrong. It's not actually pharmacology, it's pharmacotherapy, but I'll just plead it was 1 o'clock in the morning when I typed it. That picture was quite famous earlier in the year. You may not have seen it. It travelled around the world a few times. Let me read you downloaded this off the media site it came off. It's not Australian, but it could be. It's a picture showing a woman licking her methadone from the pavement in front of a child. And I'm sorry, I'm just getting choked up already. This shocking picture showing a woman licking methadone from a pavement as a child looks on has sparked fury. The photograph was taken by a stunned onlooker, who then drove on, outside Edinburgh's Wester Hales shopping centre after the woman dropped the heroin substitute. The woman in her 30s had gone to a chemist for her weekly prescription. She was accompanied by a friend and a young girl. She was on her way home when she dropped the liquid. She then knelt down and licked it from the dirty pavement. If you find that on the media website, you will find underneath that a whole bunch of posts that basically drip vitriol, expressing what they think of a woman who would A, be on methadone in the first place, and B, who would stoop so low as to lick it off the pavement in front of a child. The last post on that thread was by a guy called X-Jack, who said, "Shame it was the pavement and not the middle of the road." If we go back to the fact that she probably only had half her income at the beginning, and she's been paying off a whole bunch of things, and if it was in Australia, she probably, had she been incarcerated, she would have had 4 weeks of assistance with her pharmaceutical bills once she got out, but then she was on her own. There might be some subsidies for it, but the average person on methadone in Australia still pays between $15 and $70 a week for their medication, which takes a fair bit of that other 50%. If you've got not much left in your pocket to feed your child and you drop your methadone, what would you do? It's a hard choice, isn't it? Many of the people who access the services that Gerry supports, and like the one we run, are in that boat and face those dilemmas on a daily basis. So let me get around to what we're doing with them. Education and employment are also huge issues. The rates of unemployment are always hard to quantify. A stat that I love to quote but is terrifying, I need to get it from the last census, I haven't been able to find it, is youth workforce participation. We hear a lot about youth unemployment rates, which always to me don't sound quite accurate. But in Western Sydney, in the last census, it was 40% youth workforce participation. I don't know that it's quite as easy as subtracting that from 100 to get the distressing figure, but I don't know that it's far off that. A lot of people like this is actually one of our retail groups, what we do in Western Sydney. That would have been a useful thing to tell you. And now's a good time to do it. In Western Sydney, we do a number of things, one of which is we inherited when we moved up and started the program there, a material aid centre that gave away food parcels to people as they came along. Those mystery bags of food. So if someone was in need, they could turn up and they get the mystery bag of what had been donated that week. So you might get a jar of anchovies and a jar of Vegemite, and good luck, go home and feed your kids. We thought we could do better than that, so we then tried to access a whole range of various foodstuffs, and including from Foodbank, and tried to give people a choice. So it looked like a little corner store, but you still came in and got what we could find. When we started talking to local people, though, they didn't just want food. They started to talk through the fact that housing was expensive, transport was difficult to come by. They had other costs, whether health-related or crime-related, and they just had little money to buy food, and they wanted something better than to just come along and get a handout. They actually wanted a pathway to employment. So we actually expanded our little store and made it into what for all the world looks like little IGA supermarket. It's staffed by young mums from the local area who've dropped out of school before completing. They come along, do a work-based Certificate 2 in retail in the store, and then we find a pathway on for them into employment. The technical term is intermediate labour market. Sounds impressive, but that's basically what it is. This is a group of our young mums. None of them had finished school, they all dropped out. Some had a distressing number of children before they decided to break that cycle. They have staffed in that store. Some of them have gone on to paid employment in the store, and not in this group, but one of the others comprise the lady who is now managing the store. So some really great news stories coming out of that. Education in some parts of Sydney. One of the primary schools in Western Sydney a few years ago, 10% of the kids who finished Year 6 never arrived at high school. Of those who went on to high school, now this is admittedly old stats again, we still have to see the effect of that compulsory stay at school to Year 17 process, but before that was introduced, 10% in one primary school never got to Year 7, 30% never got to Year 10, and only 30% then finished at the end of Year 12. It's a pathway to unemployment that is very wide and trodden by very many people. In an area with 5 generations now, 5th generation unemployment in some parts of Western Sydney, aspiration is not high either. So what we do in that program in Western Sydney is not just to provide affordable food to people, we actually provide training for people in the process. In terms of that little supermarket, what does it do? We supply food at about 50%. That because the labour is cheap, and we've eliminated the large costs that the main stream retailers face, we sell food for 50% maximum of the price of the major supermarkets. We won't give food away. We're co-located with St Vincent de Paul. If you need a food handout, you can go to St Vincent de Paul and go through a really good process of financial counselling and get a food voucher and come around and spend it like a real person in the store. If you want to buy extra, you can do that. We'll give you cheap food and we will teach you how to cook it, but we will not give it to you because we do not want to add to that cycle of breeding dependency in an area where that has been the case for far too long. And there it is. That was the day of the opening. Gerry was there that day, and it supports Rosemary's line that people will actually eat fruit and veg. People told us don't stock fruit and vegetables because no one will eat them. They're mangoes down the front there. We had them for $1 each because it was the cheapest we could do it, and there were none left by the end of that day. That was an exciting thing, and I got none. So that's keep going. So what we're looking to do is support real people in a real world. The immense cost of living pressures faced by vulnerable families, the costs of food, housing, drug and alcohol treatment, transportation and infringements can't be covered by the current rates of allowances that people receive. They need assistance, and there'll be people who will always need handouts and step leg ups. But the solution to what they face needs to be a holistic approach. It needs to take into account various factors. So programs, we're not alone in it. It's a model that's being adopted by a whole range of agencies, but it's a model that looks to address food security along with training and employment options. We'll do home delivery, so you don't need transport. We're very close to getting an online presence, so you can actually be at home and order your food and get it delivered. Not anyone can shop there. You need to be, it works in a co-op model, so you need to have gone through a process to actually get to us in the first place. But it's a process that addresses a whole range of factors and is more holistic in its approach to simply just chipping away and giving out food parcels and breeding dependency. I've gone long enough. You can ask questions later.